Hello, my name is Chris Nelson. I'm here to do a video physical assessment on my patient here, Janet. Hi, Janet. Nice to meet you.
Hello.
Judy. Clean my hands first. Alright, first thing I'm going to take a look at is notice her general appearance. She looks like she's well kept, clean, and looking at her skin, I don't see any noticeable problems. Let's see here. Pink, her hands are warm. I'm getting good capillary refill on her fingers. Okay, good. Go ahead and check up further her arms for any lesions. I notice there is one tattoo there on the left forearm. Otherwise, warm and pink and dry. Skin turgor. Snaps back quickly. No signs of edema. Alright, also look at her face here. Also no signs of any sort of open sores or discoloration. Just some freckles on either side of her face. Her lips look pink and moist. And also no lesions on her lips. Alright, now I'll be taking a closer look at the patient's head. First of all, I'm going to inspect her skull, feel for any noticeable lumps or depressions or any other malformations. Alright, feel in the back of her neck. Alright, same thing. Okay, I'm going to go ahead and feel her jaw for any TMJ. Do I need to do that for me? Good. Okay, does that hurt at all?
No.
Alright, and then I'm going to palpate the patient's sinuses, starting with temporal sinuses. Feeling any pain or discomfort there?
No.
Okay, and the maxillary. Alright.
No.
Any pain? Okay, good. I'm going to take a closer look at the patient's eyes. I'm going to need you to remove your glasses for me real quick. Alright, first thing I'm going to check the patient's sclera. They're nice, clear, and white, and her conjunctiva are pink, plenty of tears there. I'm going to now shine a light in your eyes, okay? I'm going to shine it in from the sides here. Let's check, make sure there aren't any opacities or foreign bodies. Okay, alright, now I'm going to shine it directly into your eyes and check her pupils. Okay. Alright. Patient's pupils are equal, round, and reactive to light. Okay. Now I'm going to want you to follow my finger real quick. Okay. I want you to keep your head straight towards me and follow my finger to the side. Checking the oculomotor nerves. Okay. Good. Checking near far. Okay, good. Alright, now I'm going to want to check your peripheral vision. Okay, so I'm going to get real close. When you see my fingers wiggling on either side, I want you to tell me, okay?
No.
Okay?
No.
Okay. Also, now with the patient's eyeglasses on, I would have her stand 20 feet in front of a Snellen chart, perform a vision exam, and I'd have her read the smallest line that she could, and that would give me an accurate number on her need for her glasses. Now I'm going to take a closer look at the patient's ears, nose, and throat. I'm going to start by inspecting the external ear, see if there's any problems there, any dirtiness or drainage noted. They both look clean. I'll go ahead and use my scope to inspect inside the ear canal. I'm going to be pulling back and up from the earlobe, inspecting inside. Taking a look, the ear canal looks clean and pink. The eardrum is also clean and pearl white. No signs of bulging or discoloration. Go ahead and check the same on the other side. Going up and back. checking the ear canal. Same thing, clean. Eardrum is pearly white. Okay. Alright. Now with a new cap, I will check the patient's nose. I'm going to need to look up inside your nose here. Alright. Okay. Patient's nose looks clean. Turbinates are there. Skin is pink and no signs of any trauma, hemorrhaging, or okay. Now I'm going to want to inspect the patient's mouth. Just want you to open up and say ah for me. Okay. You can say ah. Alright. Patient's tonsils are barely visible. Say ah again for me. Uvula is midline. Mucosa is pink and moist. Tongue, no noticeable sores or patches on the tongue. You can go ahead and lift up your tongue for me so I can look underneath. Alright, also moist, no lesions noted. Okay, looking at the soft and hard palate. No lesions or discoloration noted. Okay, can you show me your gums, please? Smile big for me, okay? The gums look healthy, pink, and no signs of receding. Now I'm going to take a closer look at the patient's neck. Alright, first we're checking to make sure that the trachea is midline. Okay, good. We'll check for carotid pulse. Alright, it's strong. I don't know any thrill. Okay, good. Alright, I'm going to check the patient's thyroid glands. Okay. Feel nice and soft, movable. I'm also going to be checking for the lymph nodes. Okay, any tenderness there?
No.
Okay, good. How about there?
No.
Any of that hurt? Alright, now I'm going to be taking a closer look at the patient's thorax, including the lungs and heart. Alright, so first I'm going to be taking a visual of her chest and then palpate the skin, feeling for any crepitus or any nodules. I'm feeling on the interior. Go ahead and feel on the posterior aspect, thorax. Okay, no tenderness anywhere there. Okay, now I'm going to go ahead and take a listen to her lung sounds. Starting at the top. Alright, each time I move the stethoscope, I want you to take a deep breath for me, okay? I want you to kind of lift up on your breast for me a little bit. Thank you. Other side. Okay, I'll take a listen to the posterior side. Deep breaths. And I'm also going to want to take a listen from the axillary region. Deep breath again. On the other side. Okay, the breath sounds are all equal, clear, no noticeable crackles or wheezing. Now I'm going to go ahead and take a listen to her heart. Okay, we'll start with the aortic valve, pulmonic valve, tricuspid valve. Okay, and you lift up on that fourth breast one, and mitral valve. And while I'm doing this, I'll also use a watch and listen to that apical pulse. Okay, apical pulse is regular and Now I'll take a look at the peripheral vascular system, checking pulses, radial pulses. Okay, strong radial pulse there. There. Check down at her feet. Take your socks off, please. Okay. Checking the dorsalis pedis pulse here. While I'm at it, I'll check capillary refill on the toes. Blanches, it goes pink right away. And check your other foot too, please. Good pulse. Good capillary refill. Her toes are a little cold, but it's just cold in here. Capillary refill is good. Okay, thank you.
Okay.
Okay, now in order to assess the patient's abdomen, I've got her laying supine in the bed. I'm going to go ahead and ask you, Janet, to if you please pull your shirt up a little bit so I can see your abdomen. Thank you. Alright, first I'm going to look and see if there's any irregularities. It looks symmetrical to me. Her skin looks intact and similar to the rest of her body we already examined. I'm not seeing any abnormal pulsations or anything like that. So now I'm going to go ahead and auscultate. Take a listen to the 4 quadrants. Okay, I'm hearing normal bowel sounds with small tinkling noises every 5 to 30 seconds. I'm going to go ahead and percuss the abdomen. Alright. Listening for tympanic sound. Okay, good. And then I can go ahead and palpate for the spleen. Feeling that? Okay. And then I'll also try and judge the border of the liver over here. Okay. That's right there. Okay. Go ahead and palpate your abdomen. So I'm going to press down lightly on your stomach now, okay? Alright. Are you feeling any pain or tenderness?
No.
When I press down anywhere?
No.
Not feeling any irregularities. Okay, and then I'll check for rebound tenderness here in the lower right corner. Okay. You feeling anything when I remove my hand quickly like that?
No.
Okay, alright. Okay. Next, I'm going to go ahead and test my patient's range of motion, starting with the hands and feet. So I need to go ahead and stick your hands up for me. Alright. Take a look at them. And I'm going to feel the knuckles for any signs of arthritis. Okay. Alright, now I need you to pull them out for me, and you need to pull them up. Alright, flexion and extension. Okay, good. And now I want you to take them out to the side, and then inside. Okay, excellent. Alright, now go ahead and I need you to reach back behind with your arm and try and reach the middle of your back. Good. And then down and from underneath as well. Okay. And then same with the other arm. Alright, reach back. Okay. Down. Underneath. Okay. Get good range of motion in the shoulders. Okay. And you go ahead and stick your hands out again. Alright. We're going to check for pronation and supination. Okay, excellent. Alright, go ahead and relax your arms for me. Take a look at your feet. Okay, same thing with your right foot. I need you to go ahead and extend it and flex it for me. Excellent. And then inside and out. Excellent. Okay, same thing with this foot. Okay, down and up, and out. Excellent. Thank you so much. Okay, you go ahead and stand up for me. All right, you need to check your spine, so if you can just lean back for me. All right, any pain, discomfort there? All right, go ahead and move forward for me. Well, I've got her touching her toes. I'm going to be feeling and examining her spine for any scoliosis. It feels pretty straight. Not noticing any nodules or lesions along the spine. Go ahead and stand back up for me. Thank you. All right, last thing, I'm going to check the hips and knees. If you could go ahead and do a little squat for me. All right, good. And back up. Okay, excellent. All right, go ahead and take a seat. Okay, now I'm going to go ahead and test my patient for coordination and reflexes. Okay, so the first thing you need to do is put your hands flat on your lap, all right, and then fold up, turn over, put them back down on your lap, and then keep doing that as fast as you can for me, okay? Good, all right, go ahead and relax. All right, the next thing you need to do is to go ahead and test her deep tendon reflexes. I'm going to go ahead and start with the patellar reflex. I'm going to feel her patellar, the bottom of it, and then go ahead and there we go. Alright, same thing on the other side. Alright, and now I need you to go ahead and stand up for me, please. Alright, and head over to the bed and get on one knee in the bed for me so you can stick your foot out. Check the Achilles reflex. Okay, good. You can barely see it, but if you hold the foot, you can also feel a little bit better. Okay, and I need you to switch feet for me, please. Alright. And okay. Alright, now I'll go ahead and have the patient lay in there. And we're also going to go ahead and do a Romberg test on the patient. Alright, what I need you to do for me is to hold your arms out straight in front of you and close your eyes. Noticing she's got a little bit of a wobble, but otherwise a negative Romberg test. Okay, go ahead and open your eyes. All right, for the last part of the exam, I've got the patient laying supine in the bed again. All right, the first thing I need is to take her arm. I'm going to check her brachioradialis reflex. All right, and I'm going to be striking right here on the radial side of the hand. Feeling for a slight twitch in her arm, contraction of the muscles there. Alright, good. Alright, so the next thing, testing her coordination, hand-eye coordination. Alright, and you take your left index finger and touch your nose for me, please. Now touch my finger, back to your nose, to my finger, back to the nose, finger. Good. Now do the same thing for me, please, with your right index finger, nose, my finger, nose, finger, nose, finger. Excellent. Okay, now go ahead and close your eyes for me. I'm going to test the patient's sensation starting in her face. Now, I'm going to touch you with this gauze here on one side of your face, and I want you to tell me which side you feel it on, okay?
Right. Left.
Okay, we'll do the same thing down in your arms.
Left. Left.
Got it?
Right.
Okay, good. And I'm going to do the same thing down at your feet.
Right. Left.
Very good. The last thing we need to do is check the patient for a Babinski reflex. So I'm going to have to remove her sock. Okay, take the blade of the hammer here and run it up. Okay, that's a negative response in an adult. Checking it again on the other foot. Alright, also negative response. Okay, that all being done, I'll ask her if there's any questions you have for me. Anything else I need to know?
No.
Okay, everything's good? Alright, and that concludes my assessment.